In pursuit of universal health coverage, many low and middle income countries like the Gambia are reforming their health financing systems and introducing health insurance schemes that pay for the cost of health services for their citizens. In 2021, the government of the Gambia introduced the National Health Insurance Scheme, a bill that seeks to reduce out-of-pocket expenditure for middle and low earners to access basic healthcare services. The National Health Insurance Authority, the body mandated by the Act, has been leading the charge to license and regulate all private health insurance schemes. On Thursday, the National Health Insurance gathered stakeholders of the Insurance Authority and other private healthcare providers to highlight their progress and plans to provide healthcare coverage for people registered in the program.
The National Health Insurance Scheme is designed to protect residents from the financial strains of accessing essential healthcare services. Our goal is to create a system where no one is left behind, where every resident, regardless of their background or status, can receive the care they need without financial hardship. As we provide updates on our progress today, we remain focused on the road ahead. Together, with the support of our partners and key stakeholders present here, we are building a stronger, more inclusive healthcare system for the Gambia.
According to officials, 538 women were enrolled, with 399 finally registered for the National Health Insurance pilot in the second phase of the advancement. The Director of Health Services of the National Health Insurance, Dr. Hassan Jai, outlined the progress registered during the year under review.
NHIS implementation started with a pilot at one of the hospitals called Bondong Maternal and Child Hospital, and this was in July 2023. We started with Bondong Maternal and Child Hospital simply because it is, a maternal and child hospital, and our focus at the time was maternal and child health services. However, after a year or so of implementation, with lessons learned and opportunities and challenges, we decided to expand the NHIS to 12 additional public health facilities. And this includes all the general hospitals, the specialist hospital, except Sheikh Zayed Eye Care Center, simply because they provide eye care services.
The plan for the few coming months or just next month is to expand the rollout to 54 health facilities. That is about 60 public health facilities in the Gambia. As you can see, for any national health insurance, it's a social health insurance, a means of social protection for its population, covering not only the healthy, but as well as the most vulnerable. That's why the distribution here is done based on equity, based on health and equity principles or theories. Health as a public good needs to be equally distributed among its population, unless its unequal distribution favors the least disadvantaged. That is why you are seeing this diagram map of how we want to roll out in the next few months.
Stella Jata, a senior nurse at the Kanifing General Hospital, outlined the significance of the scheme in providing accessible healthcare services to the population.
In Kanifing, we have a high registration of babies coming for their birth certificate. It's not magic, it's just through the NHIS scheme. So now most of our mothers are seeing the importance of having the insurance card and having the new birth certificate. So I want to encourage NHIS to spread it out to the other facilities so that those people are the community, because some, even they want to travel all the way to come to Kanifing just to deliver, so that they will be registered for the new birth certificate and their baby to have a birth certificate to be part of the scheme.
The briefing culminated with a critical interaction as stakeholders took time to broaden discussions, providing clarifications on their mandate and plans to extend the scheme to other hospitals and communities. Omar Faye, GRTS.